Hello, everyone. Thank you for joining us. We're just going to give it like a minute or two while everyone joins on to the call. Welcome, everyone.
Good afternoon, everyone. Hope that you're well. Happy Sunday and the end of February. Thank you for joining our second forum on COVID-19 vaccine. Before we start, we're just going to acknowledge the land that we are on. So today we acknowledge the land in which we gather and work is situated on traditional territories. These lands were originally the homes of the Wendat and Neshabek, Haudenosaunee, Métis, and the Mississaugas of the New Credit First Nations and continue to be. Today, the meeting place of Toronto is still home to many Indigenous peoples from across Turtle Island, Canada, and we are grateful to have the opportunity to work in the community on this territory. We recognize that many of the barriers faced by newcomers in their settlement on this territory continues to be faced by Indigenous peoples across this land. We make this acknowledgement because we are committed to anti-oppression, anti-racism, and equity in all aspects of our work. So thank you. And again, welcome. I'm going to pass it over to Minera, but before I do that, I just want to, again, some quick housekeeping rules. So today's session is being streamed live on our Flemington Health Center website. Our questions today have been pre-submitted to the Health Access account and through community groups. So we do have a set of questions that our panelists will be answering today. We will also answer questions in the Q&A chat box. So if you do have a question specific to our guest, please place the question in the chat box. And once we're finished our pre-submitted questions, we will answer those. Again, our session is to go to 5 o'clock today. We're really hoping to end right at 5, as we understand it's Sunday and we want to spend some time with your family. And on that note, I will pass it over to Minera.
Good afternoon, everybody, and assalamu alaikum. Once again, we thank you for joining us this Sunday afternoon. I'd like to introduce our panelists for joining us today. Dr. Omar Ali Khan, if you'd like to take a minute to introduce yourself, please.
Assalamu alaikum. Hello, everybody. My name is Dr. Omar Ali Khan, and I have been a part of the Thorncliffe Health Center working with my colleague, Dr. Khalid Zia, in the community since the start of 2014. And I'm a family physician, and me and Dr. Khalid Zia, we've been associated and working very closely with HATP for the past couple of years as well.
Thank you. And Dr. McCready.
Hi, everybody. Thanks so much for having me. I'm an infectious disease doctor at Michael Garron Hospital. I think about 2012 now, and really was focused on mainly hospital care until COVID came along, and then have tried to support our communities as much as possible, and have really gotten to know Manira and the Thorncliffe and Flemington communities through our work with the schools and really supporting your amazing principals and all the amazing students there at the school. So thank you so much for having me. It's really nice to be here.
We're really happy both of you are here today. So without further ado, we're just going to jump right into our questions. Amira, do you want to go ahead and start?
I'm just going to do a really quick, my name is Amira and I work with Health Access Thorncliffe Park, and my colleague Manera, also employee of Health Access Thorncliffe Park, and we are your moderators for today. Now I'm going to start. So our first question is actually for Dr. McCready. I'm going to read, we have 4 questions in this sort of segment. So if you could answer, if you need me to repeat, please let me know. So the first question is sort of, how effective is the Pfizer vaccine if prescribed guidelines are not followed? And then the other follow-up sort of question to that is, how can the powers that be just change the 21-day recommendation schedule, especially for our healthcare workers seeing COVID patients?
Yeah, so good question. And so the data on this is evolving, but if the traditional way that it was studied was at 21 days between the first dose and the second dose. But there is some data that hasn't been published, but has been shared kind of amongst the some of the agencies that are deciding on when to give the vaccines. And it looks like that if the interval between the first and second shot is lengthened up to 42 days, it is still extremely effective and should still be basically 100% effective at preventing severe disease and preventing hospitalization. So I am very reassured by that. And in fact, there is some theoretical thought that if the time between them is extended between up to 3 weeks, up to 6 weeks, then it actually may last even a bit longer. So any time frame within the 21 days up to 42 days is acceptable to have the shot separated. And in terms of, the powers that be deciding, when it's okay to do that, I think there was a lot of thought that went into trying to get vaccines into people's arms as fast as possible, but weighing the risk of making sure it was still efficacious. And so they looked at the available data, our understanding of vaccines, and then the judgment call was made to be able to extend it. So knowing that, I have colleagues that have gotten their vaccine separated by that amount of time, and I'm very confident that their vaccine is protecting them.
Okay, perfect. Thank you. And then the other two questions are, should they be checked for antibodies at some point after the second dose? And how many times will we be vaccinated annually? How much is the dose?
Very good question. So in terms of whether someone after they're vaccinated needs to be checked for antibodies, not on a regular basis and not for people that are outside of a study. So a lot of the antibody tests that are commercially available, they don't necessarily check for the spike protein. So the specific part that is shown to your immune system that then your immune system makes antibodies to. So if you did some of those commercially available antibody tests, it might not show that you have any immunity, and that does not mean you're not protected. So on a regular basis, we would not recommend that people do antibody levels to see if they're still protected. What we're learning and what we're going to continue to learn is that from people that are doing the studies on the vaccines, they'll have volunteers related to the study that will have their antibodies checked in a specific way going forward to see how long those antibodies last. And that data is ongoing from the people that were initially enrolled in the vaccine trials, and it will be ongoing going forward. And then in terms of the question of how long will it last and how, when will we need to be revaccinated, we really don't know. So that is a question that, this virus is still really in its infancy. It's starting to become a toddler at this stage. So we will learn a lot more, I suspect, in the next year and then the year after that to see, again, they'll be monitoring people that got vaccinated, their antibody levels, and also keeping a close eye on people that have had vaccine and then if they get COVID-19 again. And then, it may be that it's every few years you need a type of booster that the vaccines are modified, but I think that is to be determined. But we're hopeful that it will be at least protective for, a year or so at least, and we'll learn more as we go.
Perfect. Thank you, Dr. McCready. Dr. Khan, your first two questions are, when are people over the age of 60 going to be vaccinated? And will seniors experience more side effects than those less than the age of 60?
Okay, so at this point of time, the thought is that we're going to be having the vaccination starting for 80 plus seniors. And from the information we have at this point of time, they're going to be starting early next week. The official announcement, I'm told, is going to be probably by tomorrow afternoon. And once they start vaccinating the 80 plus seniors in the community, in the weeks to come, they'll go in increments of 5 years. So first we'll do our seniors 80 plus, and then it'll come down to 75, 70, 65, and so on. So most likely in the next couple of weeks, I would say maybe about 4 to 8 weeks, mostly, the seniors in the 60+ range should have the time when they'll be eligible for the vaccine, depending on how, the rollout is. And the initial plan is that once they announce their rollout early next week, and depending on how much vaccine is available at those particular sites, they might be able to get it sooner rather than we anticipated them. And as far as the second question is concerned, for 60+, whether it's the side effects are going to be more, well, it's not that people who are younger can have more side effects as well, rather than seniors who are 60+, because I have seen with a lot of my colleagues who are in the United States, their parents and a lot of 60+ seniors have gotten the vaccine and they didn't have any significant side effects other than, just maybe a little bit of soreness on the arm, a little bit of muscle aches and pains, and that's about it. And so, I mean, there's no easy answer to that, whether seniors will have, more side effects. It probably depends a lot on, the underlying medical conditions as well, and what other chronic ailments they are on, or, the kind of immunocompromise they might be having, depending on if they have, any other debilitating medical conditions that they are suffering from.
Thank you, Dr. Khan. And then the next question, it's a little bit more specific. So why are some news reporting that it is not advisable for seniors over the age of 80 to take the Moderna vaccine, or even over 65 to take the AstraZeneca, to take this vaccine? So is it safe for an 82-year-old with previous cancer history to receive this vaccine?
Absolutely. As far as the age cutoff for 80+ or with Moderna, or 65 with AstraZeneca, those are based on the clinical trials that have been conducted by those particular companies, and they have not really tested the clinical trials in that particular company in probably seniors who are 65+ with AstraZeneca and 80+ with Moderna. So we don't have enough clinical data to support evidence that it would be efficacious, or it would not have any side effects for seniors over 65 years of age with Moderna and 80+, 65 with the AstraZeneca and 80+ with the Moderna. But to my understanding, I mean, they is no such age cutoff with the Pfizer vaccine, at least not to my knowledge, that has been brought to my attention. So as far as, an 82-year-old lady who has cancer and is immunocompromised, I think she'd be more susceptible to having, a very severe illness if she does contract, the COVID infection itself. So yeah, definitely, it would make a lot more sense for that lady to be vaccinated.
Thank you, Dr. Khan. So moving on to the next set of questions, Dr. McCready, this would be for you. Could you speak a little bit to the proximity of vaccination sites for seniors who have been asked to stay at home for months? So if you could speak a little bit to what the rollout would look like for seniors in the community.
Sure. I mean, great question. We're basically, the goal is to make it as safe as possible. So there's going to be really a multi-pronged approach for seniors, and especially starting with the over 80. There's different plans in the works for some to have kind of specific clinics for just over 80 that are kind of conveniently located, places where seniors would normally go to, as well as some seniors are obviously more comfortable getting their vaccines from their family physicians who they know and trust, and it's an environment that they usually go to. So there will be some vaccinations for people over 80 through their family physicians. And then there will be some mobile units as well. So if people live in buildings where there are more more older people living, then there will be outreach to those buildings. And then the goal will be to give them vaccines, within their buildings so that they don't have to travel to a vaccination site.
And just to add on to that, Dr. McCready, we do know that just this week we are starting with the seniors building in Thorncliffe Park, correct?
Yes, which is fantastic. Exactly. Yeah,
excellent.
That's a very exciting plan going forward.
Thank you. Next question is, if the Pfizer vaccine is 95% effective, does it mean that if we happen to fall under the 5%, the vaccine would be ineffective on us? Or if we do get COVID, we would have milder symptoms even though we have received the vaccine?
Excellent question. So all of the vaccines are actually 100% effective at reducing death and reducing severe disease. So that, I think, is the biggest point to remember, is that the percentages that you hear, that is what is preventing any COVID infection. So any mild disease. So Pfizer is 95% effective at preventing mild disease, but it's 100% effective in the trials at preventing death or hospitalization. And that's the same for Moderna. So Moderna is 94.1% effective at preventing mild disease, but 100% at preventing severe disease and hospitalization. And same with AstraZeneca and Johnson & Johnson. And those ones are both 100% effective at preventing severe disease and hospitalization and death. But they're a bit less effective at preventing mild disease. But that's still amazing to have to change something that could be life-threatening into cold symptoms is extraordinary.
Thank you. And the next question is, are the vaccines effective against the variant strain, like for example, B117, the South African strain, the Brazilian strain?
Yeah. Another great question. So, so far, all of the evidence we have is that the vaccines are all effective against the B117, so the strain that originated in the United Kingdom, which is more of what we're seeing circulating here or starting to circulate here in Toronto. And in terms of the B1351, so that's the strain that originated in South Africa, and then also the strain P1 that originated in Brazil. So again, the vaccines still seem to be very effective, if not 100% effective at preventing death from if they're given for those strains, but they are a bit less effective in preventing any disease. So in the Pfizer and Moderna were not specifically studied in the population yet in South Africa, but for AstraZeneca and Johnson & Johnson, they still were able to prevent severe disease and death. And they were about 62% and 57% in preventing any disease. So still, the most important thing is that it's preventing death and preventing severe disease. And they have been shown to be very effective against the UK virus, or not UK virus, but the virus that originated in the UK with the B117, which is what we're kind of most worried about here in the next few months.
Thank you. The next question is, for people living with HIV and undetectable viral load, how concerned should we be about the vaccine drug formula interactions with antiretrovirals?
Yeah, so I would not be concerned at all. I would, if you are offered, or when you're offered the vaccine, if you are someone who is living with HIV and takes antiretrovirals, there would be no drug interaction. The way that any of the vaccines work is that they kind of present a blueprint to your immune system, and then your immune system makes a copy of that they can respond to, and then that blueprint disappears. Those instructions disappear. So they will not interact with any of the medications you're on. It will not disrupt your cells in any way. It doesn't integrate within you. It goes away. So it would not impact your treatment for HIV at all.
Thank you. And on the topic of kids, would it be a lower chance for kids to get COVID if everyone else in the household is vaccinated? Or might we still pass on COVID to our kids even though the adults in the house are vaccinated?
Yeah, these are great questions. So, so definitely if everyone in the house is vaccinated, it's going to make it much less likely that the children are going to get infected, because most of the time children are infected from members of their household, because you're going to have that close contact with people. So if the household is protected, it's going to be less likely to give it to kids. A big question with the vaccines is, does it prevent, obviously we know it prevents disease, so actually getting sick, but does it prevent infection? So being able to have the virus and have no symptoms. So far, there was one study so far that's shown that it is very effective at also preventing any infection. So it reduces the chance of being infected, not just being sick, but being infected reduces it by 85%. So there's still a small chance you could have it and have no symptoms, but much lower. So in that case, it would be very unlikely that you would get it and pass it on to your kids. Certainly it's possible, but much less likely. And just to add, this wasn't part of the question, but there are trials ongoing now, starting as young as age 12. And then also I've seen some other trials with different vaccines, I think going down to age 5. So interesting and hopeful outcomes to get everybody vaccinated that are in progress.
Thank you. And just to add on to that question, is that once the vaccine is available to children, will it become mandatory to have all students get the vaccine before they go back to school? And if they don't get the vaccine, is there a chance they might not be able to attend school in person?
Yeah, so I think it'd be very unlikely that the government would make it mandatory. I think that, I think it's obviously very important for us to be able to keep the kids in school, and it's the safest thing is for as many people to be vaccinated as possible. I'm not the one that makes those decisions at those levels of the government, but I do think it would be unlikely for it to become mandatory, especially, in the next couple of years. And so I think I expect children will still be able to attend school, that there will still be precautions in place, and if enough people aren't vaccinated, then there will still be more disruptions in learning. So it is in everybody's best interests for everyone that's offered a vaccine to get it as fast and as soon as they can. But I think it will be unlikely it will be mandatory anytime soon.
Thank you. And the next set of questions is for you, Dr. Khan. So about side effects, what are the short-term and long-term side effects of this vaccine? Is it true that we could face symptoms like depression and emotional instability after receiving it?
So as far as the short-term side effects are concerned, again, it varies from individual to individual based on how the body will respond. Certain side effects that have been noticed are, definitely, as I said earlier, soreness at the site of the injection, some body aches, fatigue, and low-grade fever and sore throat is also something that people have encountered. The long-term sequelae, I think we are still in the infancy stage of the vaccine to decide or to comment about, the long-term side effects. But people who have gotten vaccinated, a couple of months ago, I mean, they haven't come up with any long-term sequelae. But as I said, there's no clinical evidence or documentation or data out there that can comment about the long-term side effects, because we are still in the initial rollout phase of the vaccine. As far as getting depression and emotional instability, I don't think that is something that is associated with the vaccine. Definitely, people who are not getting the vaccine, or people who have had infected, if they have had if the infection was so severe that they ended up in the hospital, or they were really sick, and all the other members of the family got infected, it did place a huge burden on the entire household, because income was lost, and because they were so sick that they were not able to carry around the activities of daily living at the usual basis. So they did have some amount of depression, but not from the vaccine itself. In fact, if you do get the vaccine, we know for a fact that it will definitely prevent a lot of deaths and hospitalizations. And the chances of getting infected is significantly lowered. So that is something, the community will have to bear in mind.
Thank you. So the next set of questions, this is all about side effects, is that first of all, are the side effects of the COVID vaccine more severe than the flu shot? And secondly, are the side effects apt to be more severe, less severe, or unchanged from one dose to the next?
So as far as, if on a comparative basis, when you're comparing the COVID vaccine to the flu vaccine, there's no evidence as to say whether, the side effects are more severe with the COVID vaccine. Some people have felt a little bit more compared to the flu vaccine. But again, as I said, it also depends on, a lot of underlying medical conditions and how the body would respond. But there's no head-to-head trial that would compare, the side effects of the flu vaccine versus the COVID vaccine at this point of time. And coming to the second part of the question, depending on the side effects from the first dose to the second dose, people have noticed, the kind of feedback I'm getting is that the second dose, they had a little bit more body aches and fatigue when they compared it to the first shot. And I think that is basically because, the body is mounting a more stronger immune response with the second vaccine as compared to the first. So that would probably be, the best explanation as to why, if people did have any side effects, like, body aches and fatigue and low-grade fever, it was a little bit more with the second dose when compared to the first, based on how, the immune response of the body was, that it was mounting, a higher response to the second vaccine dose, because, the body would make more, T cells and B cells that would have a more aggravated response to the second dose compared to the first, because it already has, memory cells from the first vaccine dose.
Perfect, thank you. And just to follow up to that, I see a question in the chat that that directly relates to side effects. Could you speak a little bit about like if there's more side effects in seniors, number one, and secondly, does the impact of side effects, like does it change with underlying medical conditions? Like those with underlying medical conditions, are they apt to get more severe side effects from the vaccine?
So people who are having underlying medical issues, for example, people, who might be having immunocompromised or on, some kind of therapy wherein they are taking immunosuppressants, maybe, they might experience a little bit more side effects based on the immune response that the body will mount compared to the general population. But we don't have enough clinical data to say one way or the other about that yet, because as I said, we are still in the infancy stage of the vaccine rollout. So that will become more apparent in the months to come with the vaccine rollout.
Perfect, thank you. And the next question is, are there any ways to lessen the side effects in preparation to take the COVID vaccine? If in general, we always get side effects from the annual flu vaccine, for example, is there anything that we can do a few days or a few weeks prior to receiving the vaccine?
One thing is, people who are complaining of, body aches and weakness, after some of them that are experiencing after taking the vaccine, the best thing to do is that, you could take some 1 or 2 extra strength Tylenol, maybe about an hour or two before you go to take the vaccine. So that would, kind of decrease, the arm soreness, and also being well hydrated before you go to take the shot. that would definitely be more helpful as well, because then, the body is more hydrated before you go to take the vaccine.
Thank you. And the next two questions sorry, I'll just read this as three questions. Firstly, is it true that many people have tested positive after taking the vaccination? And secondly, is it true that many people have died after receiving the vaccine?
So I don't think that is true, that anybody testing positive for the vaccine. So that is definitely false. And people, I have known a friend of mine who's an internist in Chicago. So he went for the vaccine, and he was not feeling well. He was just having muscle aches, and he went to take the vaccine. And he's an internist himself, and he tested positive, a couple of days after. But that was probably because he had contracted the vaccine, being a frontline worker. But being testing positive after taking the vaccine, it is an mRNA vaccine, and it does not cause you to have the disease at all. So that is totally false. And coming to the second part of the question, I do not know of any data at all wherein anybody has died after taking a vaccine as a direct side effect from the vaccine. As I said, it could be that, it also depends on the underlying medical conditions that the person is having, and what chronic ailments that he or she might be suffering from.
Thank you. And the next question is it still advisable for us to be in quarantine for 14 days after being vaccinated if we travel to another province?
Yes, the quarantine rule will still hold good for the 2 weeks, and also using the face mask, because what we're trying to do is you're trying to reduce the infectivity while you are traveling. So I think the quarantine rule would still apply for the 14 days after travel until we have more information that's coming our way, that we don't have to do that once the vaccine rollout is in the next stage, and the federal government and the health ministry would come up with further regulations and recommendations regarding that.
Excellent, thank you. And just to follow up to that is, again, about infectivity and transmissibility is, can we still spread COVID to others after we're vaccinated, or will our immune system curve COVID before we can pass it on to others?
Yeah, I mean, it's the similar answer as Dr. McCready was mentioning earlier, that, it will definitely prevent, deaths and hospitalizations. And, getting the vaccination would definitely prevent you from getting sicker. But just the fact that the infectivity rate will reduce significantly in the household, like if, the adults in the household are taking the vaccine, the chances that they are passing on the illness or the infection to the other household members or to the members in the community when they are moving around is significantly reduced after taking the vaccine.
Thank you.
Thank you, Dr. Khan. Okay. So I just wanted to say, I see that Dr. McCready is answering some of the questions in the Q&A box. So thank you very much. So if you have posed a question in there, you may have a response in there from Dr. McCready. So thank you. The next sort of questions are for Dr. McCready. I'm going to put sort of 3 in 1, but if it's too much, just let me know. So you've kind of actually responded to one of these already, which is, what is the difference between each of the vaccines available in Ontario? There are so many vaccines, it's quite confusing which one is the best to take, who decides which vaccine you get, and how does one ensure the second dose is by the same manufacturer?
Yeah, so good question. So I think the best vaccine is honestly the one that you can get as fast as you can get it and get it into your arms. So as I said, all of the vaccines are 100% effective at preventing severe disease and death, which is really the most important thing. And I know we talked about different age age groups and different cutoffs. And the Health Canada has looked at all of that evidence, and they have licensed the vaccines for all age groups. And so there have been specifically some questions about AstraZeneca and the older, like people over 65, and whether it's effective. And fortunately, there is some new data from some places, including just recently, I think from Friday or a few days before that, from Scotland, that showed very good efficacy data from in over 65s and over 80 for giving AstraZeneca and preventing severe disease and death. So that's very reassuring. And really, all of the vaccines have, are very safe, have minimal safety issues, and are very efficacious. So really, whatever you're offered is what I would recommend getting first. The only caveat to that is perhaps if you've had severe allergic reactions to vaccines before, the rates of allergic reactions or anaphylaxis with Moderna and Pfizer are very low. So in Moderna, it actually has only been 2.5 cases per million. And in in Pfizer, it's been 4.7 cases per million. So overall still very low, but if you have a history of very many anaphylactic reactions, then you may want to get, the AstraZeneca or the Johnson & Johnson when it's available, or consult with your physician. But it's still very low risk for any of those to have an allergic reaction. So that the best one would be just the one you're offered. And I've told my family that whatever one is they are offered to, just get it whenever you're offered it. So that's good, advice from my family as well as, everybody else. And then in terms of who decides which one, so, I mean, it's all going to be depending on what is available, what we have in the freezers when people are offered them. I don't know if people are going to have, a choice. I think that I would really recommend, if you're offered to get it sooner rather than later, I would go with what's available, because you don't want to wait that time and risk getting infected, especially if the numbers do increase again in the next 4 to 6 weeks. And then in terms of ensuring you get the same dose, everything is recorded very clearly in a data entry system called COVAX. And so everything would be very, very clearly recorded so that it ensures that you get the same dose of the same vaccine the second time. So we take, not me, but whoever is in charge of your vaccination site would take care of that part.
Okay, perfect. You kind of already answered this question, but I'm just going to read it. So what are precautions in place at the vaccine sites for allergic reactions? What is the solution for those with vaccine allergies or complicated medical conditions where vaccine is not the answer? And then I'll ask the last one after.
Sure. So as I said, the anaphylactic and really severe allergic reactions is actually much lower than I think there was initially thought. And there was a lot of buzz in the media about anaphylaxis early, and it hasn't really come out to be all that likely. So one option would be, if you do have a really strong history, you could have the AstraZeneca vaccine instead of Moderna or Pfizer, or you could consult with your physician. And even if we've had people that have had a reaction to the first vaccine and then still saw an allergist and then were able to get the second dose with pre-treatment with medication. So there are definitely options and ways to make sure you're vaccinated. And then for people with complex medical issues, so oftentimes those are the people that really need the vaccines the most. And there aren't really any strong, hard contraindications where I would really say, anyone shouldn't get the vaccine besides a severe allergy to one of the components. So even if you have issues with your immune system or you have complex medical issues, talk to your physician. They can reach out to one of the infection doctors if they have specific questions about the vaccines. But the vaccines are dead virus. So it's not a live virus. They cannot give you COVID and they cannot make you sick. So it's perfectly safe to give the vaccines to people, even if their immune systems are not 100%.
Okay, perfect. And then that last follow-up question to that is, does the vaccine work with persons with addiction issues?
Yes, definitely. So it would definitely work and would be as effective as in anyone else. And I think the one thing I would add to the last question, that if there is someone that really, can't get a vaccine for whatever reason, and until they are even offered it, that's why all of us, still have to keep doing all the good things that we've been trying to do to keep everybody safe. So wearing a mask, keeping the distance, and washing hands, staying home only when you don't need to go out, until we get to enough people being vaccinated that we're all in a safe spot. So even once you get your vaccine, you still gotta wait till the rest of the world catches up.
Great, thank you, Dr. McCready. Dr. Khan, the next couple of questions are for you. So I'm going to put, again, 3 questions together. So who will decide when to give us the appointments for our vaccine? So I guess the communication method, who will inform the community when it's our turn to get the vaccine, and sort of what is the timeline we're looking at for vaccine rollouts? And so I know you mentioned that a little bit earlier.
Yeah, those are wonderful questions and very relevant. So as far as, who's going to be deciding regarding the appointment, once the vaccine rollout, in the community in Thorncliffe and the Flemington Park, from my understanding, they're going to be starting early next week. And they are going to be setting up 2 places, to my knowledge, at this point of time. One is, the Thorncliffe Community Hub. And the second one is going to be just give me a sec here. I believe it's the Warden Hilltop Community Center, when there's going to be, the second place where they're going to be getting the, setting up the vaccines. So they're going to be getting the vaccine either at one of these 2 centers or at Michael Garron Hospital. And as far as who will inform them in the community is concerned, it depends on, what category that you fall under. If you are a person who is associated with a clinic or a healthcare provider, that will be in the phase 2, like someone who's working, probably in a doctor's office as a MA, or as a pharmacist, or is an aide at the doctor's office. They'll be getting it probably, in the next week or 2, based on the announcement that's going to be coming our way early next week. And if it is someone who's, from a general person from the community, they would probably be having to wait till the end of phase 2. That would probably be later in the spring or early this summer. And once they log into on the website, one of these websites, whether it's the East Toronto Community Center at the Thorncliffe Parkway Hub, they'd be getting that information, or even at the Michael Garron Hospital website, where they can go and pre-register themselves for the vaccine, and they would be informed about a tentative date that they could pick and choose, I guess.
Well, so you answered the question already. But the next question was, how many days gap is there between the notification and the actual appointment? How long is the appointment? And then the other question is, do you do a full health checkup or check with your doctor's report before deciding to get the vaccination?
So the timing between the notification and appointment, I'm not too sure about that myself, because again, as I said, it depends on the vaccine rollout. Once the rollout is out there and it is available, patients, they will have the opportunity to go and pre-register themselves. And once they do the pre-registration, they will be informed notified about their vaccination date and time, and they just have to follow those instructions that would be communicated with them. How long would the appointments be? I guess it doesn't take too long, probably about 15 minutes for the actual appointment itself, to go and get your shot. There's because you're allotted a particular time to come in for the vaccine. So I think the wait time is not too long, max, I would say maybe half an hour, 15 minutes to half an hour is what you're looking at.
Sorry.
As far as a full health checkup is concerned, no, that is definitely not a requirement. And you do not need a full health checkup from your doctor to get your vaccine. Anybody can definitely go and get the vaccine. and you do have to sign a waiver before taking the vaccine as to, because some of them could be allergic to some of the components of the vaccine. So you would be given a form before you sign it, wherein you'd be made aware of the components of the vaccine. So you could go through them and tell them if you are indeed allergic to any of those components or not. And if not, then it's safe to go ahead and take the vaccine.
Thank you, Dr. Khan. Okay, Munira, it's all yours.
Just to follow up to that question, and I'd pose this to either of you, Dr. McCready or Dr. Khan, is in the chat, I'm seeing a question just about how the vaccine is documented. Like when we receive the vaccine, then is there some sort of a vaccine card or a proof of vaccination that we receive that we can show if in the coming months we need to travel or cross into another province, etc.? And I'd open that to either of you.
But from my understanding, I mean, there is a portal. So when you go and take the vaccine, so it'll be uploaded on the portal. So they are keeping tabs of who in the community has been vaccinated. So that way, they know that if in case you have any travel plans, there is documentation on the portal wherein it does show when you have had the first vaccine and the second vaccine as well. Did you want to elaborate on that, Dr. McCready?
Yeah, I mean, that's my understanding as well. There's this giant database called COVAX. And so when you get vaccinated, the results or the vaccine will go in there, and then same with your second dose. And then I think in terms of, if you'll get a card or something at the end of that, I think that that's kind of in the works. What you do get a piece of paper that's printed out from that system when you do get your vaccine. And then it also tells you the time of your next appointment if it's your first dose. There's also an app called Can Immunize if you have a smartphone that is integrated with Health Canada. And so I can find the link for that, but it's just CAN and then Immunize, and it does integrate with Toronto Public Health as well. So you can record, if you want to keep a record of your own, in there, then you could put that in there. And then I'm assuming, and we, all these plans are evolving quickly, but hopefully the province will have a plan for, issuing kind of certificates or whatever the process will be from that database. But everything, it will be in there, and you'll have proof of vaccine from that.
Thank you. And then moving on to the next segment of questions, Dr. McCready, this is for you. Is that in the future, would the vaccine become mandatory in order to apply for citizenship, for university, for employment opportunities, or for traveling internationally?
So, I mean, again, I think those decisions are way above what I'm party to, but I suspect that it won't be made mandatory, but it will be strongly encouraged. And there may be certain, recommendations or restrictions for people that aren't vaccinated. So for example, if you were hopefully, once we have a good portion of the population vaccinated and we have good data that the vaccine is efficacious, that the quarantine period for vaccinated individuals may be decreased or eliminated, versus if you don't have a vaccine, then you'd still have to potentially do that 14-day quarantine. The same thing as if you were exposed to a case of COVID-19 at school or in a workplace or, in your community. If you were vaccinated, once we have more data, then those people may not need to quarantine anymore and isolate at home, versus if you haven't been vaccinated, then you may still have to do that 14 days of home self-isolation. So I suspect it won't be mandatory, but there may be changes and restrictions so that we're still able to prevent the spread amongst the people that have not received their vaccinations.
Thank you. And the next set of questions, they're somewhat similar, so I'll just read them all out together. That if I'm not interested to get the vaccine this year, will it be possible to get it later on? And can we refuse to take the vaccine? Yeah, and those are the two questions.
Yeah, so at this point, the vaccine is totally voluntary. No one is gonna, come to your house and force you to get it. It's definitely voluntary, and if you are feeling like you don't know if you want to get it, or if you have questions about it, I would encourage you to reach out to Manira, Amira, or your family physician, or other supports, and or come to these things and ask the questions that you have concerns about, if there are specific concerns. And then in terms of, if you want to wait and see, and if you want to get it later, then there should be, I suspect that there'll still be vaccines offered and available. This is not if you miss your chance next week, then you're never going to get it. Certainly, I think that it will still be offered. I think one thing I've heard from a lot of people is that they want to wait and see how it goes, and they want to see how other people are doing. So to date, worldwide, and I had to look this up this morning because I was astounded. So 236 million people worldwide have already received a vaccination. So that's, it's amazing. And obviously not as many in Canada, only about 1.84 million have received in Canada, but by the time that we're offering vaccines, to basically everybody, there's a lot of safety data out there, and there's a lot of people that have received their vaccine and have been fine. And as Dr. Khan said, I have not heard either of any deaths related to the vaccine where it actually was caused by the vaccine. So I think that's, it's definitely, it will be available later, but there are, now we have the only benefit to being a little bit behind is that there is a lot of other places that have done a lot of vaccinations, and it has really shown that that's very safe.
And the next question is a follow-up to the comment that you just made, is that why is there a delay in Canada with the vaccine rollout when the rest of the world has already started and is considerably ahead in getting their populations vaccinated?
Yeah, so I mean, I think there was a few different things that happened. One is that, a lot of the trade agreements with some of the countries, and they had said they were going to send us some, and then they decided to keep them from their own populations. And then one of the big delays that affected us was that the plant in the Pfizer plant in Germany decided, which is one of our main contracts from Canada was with, decided to redo their factory where they were producing the Pfizer vaccine. So that resulted in a delay throughout February for a lot of vaccines, but the good news is that it's actually significantly increased the number that they're going to be able to deliver to us over the next few months. So it does feel like we're behind, but in reality, when you compare us to, not just the United States and the UK and Israel, but to a lot of other countries, we're actually, we're not doing badly. And I think I expect to see hundreds of thousands of vaccines kind of coming on a weekly basis. And now we just got to figure out a way to effectively and efficiently get them into to everybody's arms and make sure all of your guys' questions are answered so people feel comfortable getting the vaccines.
Thank you. And the next group of questions is for you, Dr. Khan, that if someone was visiting here and needed to return, would it be possible for them to receive the vaccine here in Canada? So I'm assuming that's somebody who's on a visitor visa, for example.
Yeah. So at this point of time, I believe, the vaccines that are being offered, it's solely for the residents of Canada. So for someone who's a visitor from some other country, maybe in the later in the year or in the near future, that might be possible. But at this point of time, I think it is just being offered to residents who have, a OHIP card, because that is definitely at this point of time a requirement. So yeah, to answer that question, for visitors or sponsored parents, at this point of time, I don't think that is something that the federal government is offering, because with the current vaccine rollout, they're trying to get as many Canadians and residents immunized, and maybe in the near future, after that is covered, there might be some new rule wherein visitors or sponsored parents would be eligible as well. But as of date, from my understanding, you have to be a Canadian resident.
Thank you. And just to follow up to that, would that also include, for example, refugee claimants, so not visitors, but they're here awaiting status clarification? Would they be able to receive the vaccine?
Yeah, as long as, like, even if you're a refugee, you know, I mean, it is covered through, they have, you know, the health coverage.
Yes, the
So,
IFH.
with the health coverage, you should be able to get, you know, the vaccine.
Thank you. And with that, we have concluded the pre-submitted questions, and we'll move on to questions that we have received in the chat. Amita, I'll hand it over to you.
So I'm just going to preface it that I know we've got Dr. McCready's answering some of those questions. Again, I'm going to make a promise to all of you. We will try our hardest to get through as many as we can. We do have 2 more speakers on the forum today that we want them to share some information with you. So I just want to put it out there that if it's not answered today, we promise that we will submit it again for our next forum. Okay, so I'm just going to go in order here. I know Dr. McCready, you answered some of them. So the first one on my list here is, would people have a choice on which vaccine one can take when their turn comes and they are not comfortable with a particular vaccine? Can they request a different one, or will they lose their chance of getting it? And so that's open to Dr. McCready or Dr. Khan.
I mean, so in terms of the actual logistics of how that would happen, I'm not sure, you know, how when you go to book exactly, you know, which vaccine will be offered. You know, right now it's mainly Pfizer and Moderna, and then AstraZeneca has just been approved as of last week. But I suspect that if there was a health reason why you really, you know, you had a severe allergy, or there was a reason why you wanted to get one over the other, then that would be a discussion with the team, and then you could be offered the other vaccine. But I would really caution people to not be picky, to be honest, about which vaccine, because the vaccine that you're offered is the best vaccine. And so if there's a clear health reason for it, then for sure that's reasonable. But if you just have heard, oh, I think this one's better, you know, I would urge you not to hesitate and just get whatever you can get sooner rather than later, because you'll likely be offered the other one, but you may have to wait longer. And then the one thing I would say is that there's pluses and minuses. So with Moderna and Pfizer, they weren't studied specifically with the strain that originated in South Africa, versus we have some more data with AstraZeneca and Johnson & Johnson. And so that shows that even though they're not 100% effective against those strains, they are 100% effective against death from those strains, which is nice. And then Johnson & Johnson is not approved yet, but it should be soon. It was just approved in the United States, and that one is only 1 shot. So there's lots of, you know, things that are good and bad about each one. But short answer is, I don't think there'll be a menu, but if you really feel strongly, then I think that the vaccine clinics will do their best to accommodate you.
Thank you. And another question in the chat is, would there be local clinics offering vaccines for the neighborhood? And what would be the likely timeline for that? Could we say it would be around April or May? That would be for either of you.
Yeah, so at this point of time, we don't know which clinics in the neighborhood would be participating in the vaccine drive and the rollout. But we know for a fact that you know, the Thorncliffe Park Community Hub is definitely going to be a center for the vaccine administration, most likely by early next week, is my understanding.
Perfect. So this kind of follows up to that. Is there was mention about site proximity and mobile clinics and the possibility of getting the vaccination from family physicians for seniors. Does that mean the vaccines that would be used won't be Pfizer, which requires -70 degrees, or Moderna? Again, posed to both of you.
So I think that the thing about Pfizer, both of them, so Pfizer, it does require -70, but it can actually stay stable for 5 days in a fridge, and Moderna can actually as well. So it's just a matter of figuring out the logistics, but it won't necessarily be that it can't be those ones. I think it's working with the family physician partners and figuring out how their clinic works and how we can best integrate that. So I think that we're learning more about, when Pfizer first came, everyone was very worried about not moving it and not taking it out of the freezer, and now we've started to take it to other places and to see how long it stays stable, and we have more data. So I think that those are options for sure.
Thank you. And the next question is, how will the mobile teams or the nearby vaccination sites have the name and contact to make the appointment for those over 80 to be vaccinated? Will the family doctors be given this information as well?
So as far as, contacting for the 80 plus patients is concerned, once the vaccine rollout is announced, and to my understanding, it's going to be probably early next week. My understanding is probably later tomorrow afternoon. Once it is announced, then the patients or the family members can log into the Michael Garron Hospital website, or even the East Park Toronto, the Health Network website, wherein you could go and register yourself, and you'd be given a date wherein you could go and get the vaccine. And we're still trying to work out the logistics with various family physician clinics, wherein we would try to accumulate information about patients who are 80 plus. And we're trying to still work with the logistics to see if, we'd be contacting the families of the 80 plus patients as well, to inform them that, the vaccine rollout for, the elderly has started. And these are the sites where they can go and get the vaccination. So as I said, at this point of time, those two places are what my understanding is one is at the Warden Hilltop Community Center, and the second one is the Thorncliffe Park Community Hub. And as far as the registration is concerned, they can even do it at East Toronto Health Partners, which is ethp.ca website, or the East Toronto Family Practice Network, which is eastfpn.org. Apart from the Michael Garron website, those are the three websites that the sons or the family members can log in for their parents to go and get themselves pre-registered once the vaccine rollout for the 80 plus is announced in Toronto. I believe it has already been announced in the York region, starting Monday, like tomorrow, like tonight, midnight at 12:01 a.m. that Monday morning. But we haven't had that announcement yet come from the Toronto site. But to my understanding, it's going to be sometime tomorrow afternoon at the earliest.
Perfect. Thank you so much, Dr. Khan. The next one we kind of already touched on, but I'll just read again. Will a vaccine card be given after getting vaccinated? Would you foresee it to be mandatory to have it to enter places such as malls or grocery stores in the distant future?
I'm going to try that one. I think I think they'll have some kind of way of telling people later. Right now, it's all recorded in this one system. And then in terms of whether people will need it as kind of a passport, I think it'll really depend on how things kind of evolve in the next 6 months to a year. So I think, as we have partial protection of the community, people will still be wearing masks and still be taking precautions. And so it won't be important to have to show that you've been vaccinated, but likely not for going places like a grocery store, but perhaps for returning from trips, and for workplaces, or at the hospital, that kind of thing. If you're having a surgery and we deciding whether or not to test you before surgery. So I think a lot of these things are kind of to be determined as we see how much of the population does get vaccinated, how well that's lowering the rates of vaccination or of infection, and Yeah, I think it's a lot of it is to be determined once we see how things play out.
Sorry there, I lost my cursor. Okay, sorry. Next question is that it's relating to allergies. So what can you tell us about all the available vaccinations and their potential effects on people who have allergies, for example, to dairy or eggs? I've read that they're safe, but we should also alert the vaccine administrator if we have these allergies. I got the flu shot for the first time this year and I experienced mild throat ear side effects, even though it's safe for those with egg allergies now. I would like to get the vaccine for COVID, but I don't see much information on this topic other than let them know you have allergies. Will somebody like me be able to stay back for a while to make sure there are no serious or fatal side effects that happen post-vaccination? Thank you. And that's for either of you.
I'm going to take that one. So in terms of the Pfizer, Moderna, and AstraZeneca vaccines, so for people that have egg or dairy allergies, there is no issue. So there have not been any increased reports of any allergies in people with those conditions. The only time where I would recommend the reason they're saying to tell people about allergies is just so you can have a conversation and they can see if you've ever had a reaction to a vaccine before. But there's no components of egg or dairy within these vaccinations. So it would be perfectly safe to get vaccinated. And I think I mentioned the numbers. There was a lot of press about allergies early on with the vaccines, but then after the data so far, it's actually only about 2.5 cases per million for Moderna and 4.7 cases per million for Pfizer. And those are people, most of those people had a previous history of severe allergies to other vaccines, so not to egg or dairy. And then in terms of if you were worried, and which is totally reasonable if you're concerned, could you stay back afterwards? So after you get the vaccine, everyone would need to be observed for at least the 15 minutes. And if you were concerned, then you could let the people at the vaccine clinic know and they could watch you for an extra 15 minutes for a total of 30 minutes. Of the people that have had allergies, almost all allergic reactions, almost all of them, if they were severe reactions, were all very soon after the doses. I think it was maybe 1 or 2 that happened later, and then they didn't even know if it was due to the vaccine. And that's again with like 236 million doses now worldwide.
Thank you. Okay, so the next question is there data of people getting COVID even after getting their second dose of their vaccine? And it's a few weeks after the second dose, meaning they didn't contract COVID during their dosages.
I don't think there's any data out there regarding that, but definitely it is very, very effective. And people who have gotten it, it really significantly reduces, the chances of getting the infection and transmission as well. So I think there's no data as such that because, as I said, we are still in the early phase of the rollout, so they don't have any clinical data to say that.
Thank you. The next question is that if my mom is over 80 years old and currently in Toronto under a 2-year visitor visa, she was visiting her grandkids since the end of 2019 and is still currently in Toronto, would she be eligible to receive the vaccine for those over 80 years old once it rolls out in March?
Yeah, as I said, for visitors, at this point of time, I think it is being offered for, residents of Canada. So if you're a visitor under the current guidelines, I'm not too sure if that is something that is being offered. It may be in, the months to come, but at this point of time, from the information we have, it is being offered solely to residents of Canada.
Thank you. We'll take a few more questions and then we'll move on to our next segment. So the next question, are there any research or statistics about vaccination for people with ASD or ADHD and the effects?
So I don't think I've seen any specific data just on that group, But the way the vaccines work, there would be no theoretical concern or medical concern that I can think of that it would impact that at all. Because like we said, the vaccines basically show your cells kind of a set of instructions on how to build immunity, and then the vaccine part disappears and then your immune system just does the work. So there's been no reports of anything related to ASD or ADHD, and certainly no data that I've seen that has raised any flags at all.
Thank you. And the next set of questions, there's been a few here. Sorry. Yes, so so I have read somewhere that the Pfizer and Moderna vaccine may be effective for 6 to 9 months only. Does that mean that those who are getting the vaccine now may need a booster in the future?
Do you want to go or you want me to go?
So at this point of time, I mean, there's not enough clinical data as to tell us one way or the other as to how long, the efficacy of the vaccine would be. But as Dr. McCready pointed out earlier, the understanding is that it would definitely be effective for the next couple of months, maybe even a year. But there is no hardcore evidence or data out there that would support, the efficacy of the vaccine for how long. Or if studies have done that, that document, that definitely it'll be effective for so many weeks or months, and you would need a booster. Maybe there is a chance that later on you could need a booster dose, but it's very premature to talk about that at this point of time because we don't have that information available to us yet.
Okay, perfect. Thank you. And then the next question is, what if our family physician is not in our neighborhood, but the resident is living in Thorncliffe Park or Flemington Park? How would they trace every physician for Thorncliffe or Flemington residents?
So if I get this question right, I think are they trying to ask if the family physician is not there, how do they still get it in the Thorncliffe Parkway? So basically for residents who are in the Thorncliffe Parkway or Flemington area, as I said, once the vaccine rollout is announced, and depending on which category you fall into, if you are working closely as a healthcare provider, or if you're working in a doctor's office and you are more susceptible to get the infection, then you could register and get the vaccine through the Thorncliffe Community Hub. For patients who are not in the neighborhood, I mean, eventually these two sites, that I mentioned about the Warden Hilltop, you could probably go and get it there as well. But it will not be through the physician. The family physician, you would have to pre-register yourself and go and get the vaccine once you get an email or notification about the date and time that has been allotted to you.
Okay, thank you. Okay, and I'm just going to read our last question from our question and answer box for today. So it is, if I get Pfizer now, after 1 year, can I get any other vaccine, or does it have to be Pfizer?
I mean, good question. I think that you could likely get any vaccine at that point that was available. So, basically it's advised if you get your first dose with Pfizer, you get your second dose with Pfizer, just because it's giving your immune system the same instructions to boost. But even if someone, got mixed up and got one Pfizer and one Moderna, you still would likely have a very good, strong immune response. And there's some evolving data that even with one shot, the vaccine response is very, very good. No one's going to purposely do that, but if that inadvertently happens, so certainly after a year, if you got a new vaccine, because they are modifying them and then changing, if the virus changes, then they change the vaccine, it would be fine to get a different one at that point to reboost your immune system.
Okay, perfect. Thank you so much. So And I know there were some questions that were sent in the chat box and not necessarily in our question and answer. So I'm just trying, so bear with me for one quick second. I think a lot of these, here's the one that we haven't really answered is, can a COVID vaccine cause a false positive test on PCR?
No, so definitely not. So the COVID vaccine cannot cause a false positive test on PCR because the PCR test is detecting the viral material, so the actual virus, whether it's alive or dead, but the vaccine doesn't give you any live virus. So it would not be, you couldn't have a false positive COVID test after you got vaccinated.
Perfect. Thank you so much. So we're just going to shift gears a little bit. I'm going to pass it over to Munira, and then we'll come back to Dr. Khan and Dr. McCready at the end for some closing remarks.
So a lot of the, just as we close the question and answer portion, is that a lot of the information is uncertain right now in terms of the rollout, how the vaccine is going to be distributed in the community. So that's why this forum is here. We will continue to have this forum more frequently if needed, so that we can pass along information to all of you ahead of time, so you know what to expect, what the process will look like, when your turn will come. These are all questions that we'll be able to answer on this forum within the coming weeks as we receive the information. I'd like to invite Dr. Shakhlo Sharipova. She is a very prominent member of the Thorncliffe Park community, and she is also part of the East Toronto Immunization Steering Committee. She sits at the vaccine hesitancy table as a community member, as a community leader, and as a resident of Thorncliffe Park. So Dr. Shakhlo, I'd love for you to be able to take a few minutes and tell us about your role at this table. Go ahead.
Yes, okay. Thank you very much, Munira. Yes, good afternoon, everyone. And I'm happy to join this meeting today to talk about my role. So since December, as soon as vaccines were available in Toronto, so Michael Garron Hospital initiated organizing vaccine steering committee, East Toronto Vaccine Steering Committee, for which I have joined because I thought it's a great opportunity for me to bring residents' voice to that table, their concerns, their doubts, and in exchange to bring some reliable information to our residents. So that's how I joined that committee. And during our first meeting, we identified that there are lots of myths and hesitancy around vaccination. So we decided to also organize separately, specifically group for vaccine hesitancy. And now we are called like Vaccine Confidence Working Group. Thank you, Munira. Next slide, please. So our goals of our group is identify barriers to vaccine administration, test and review messages about COVID-19 vaccines, support development of health promotion and engagement strategies, and also share vaccine-related materials and resources, and serve as consultative group for transforming solutions and troubleshooting challenges. So as you see, in this direction, in developing vaccine confidence in our community, there are lots of levels, starting from governmental level till our grassroots level, and each level performs own duty and responsibilities. So in our community level, those community health centers, we have the responsible for redeploying staff and physicians to support vaccination, identify and engage priority patients population, and also facilitate vaccinations at local centers and support vaccine hesitancy and confidence work. And as a community member, my role is to advise and provide input on vaccination plan and also support vaccine hesitancy work in our community. So next slide, please. World Health Organization, they have developed a vaccine hesitancy model, which consists of complacency, convenience, and confidence. So more, if you want to get more details, you can go to the website and find out what those models are. And we are working on removing barriers to those models. Yeah, next slide, please, Munira. Thank you. So in our grassroots, in our community level, we are working on the barriers which will be removing hesitancy and will move forward us towards confidence. So for this work, we are involving community ambassadors and influencers to address myths and frequently asked questions like medical approved plan in plain language translation, and also organizing events such this event like live Q&A session. Thank you. So Michael Garron Hospital and our committee, we proposed these strategies for promoting vaccine confidence among our population. So it's mostly use I statement when we talk about our own experience. We address concerns around the vaccines related to race, cultural beliefs, and religion. We try to debunk myths and misinformation, and our role is also identify unique motivations, individuals which may have chosen to receive the vaccine, and also engage physicians, nurses, and other healthcare professionals from our community who are coming from different backgrounds and faiths and speak different languages to communicate with our residents, and also to ensure that information is disseminated through diverse channels such as community WhatsApp group in different languages and through media, Twitter, for instance. And also we are engaging, connecting with other diverse groups across GTA. Yes, next slide, please, Munira. So till February, so this information a little bit outdated, this information from February 2nd. So you see what kind of, what milestone we have achieved together with Michael Garron Hospital and other healthcare providers in East York. We are meeting monthly. So next week I am going to receive like more updated information. And of course I will share those information with our community. Thank you, next slide. And also our committee made some draft requests from the Toronto region and Toronto Public Health regarding vaccine strategy in our communities. So you see we have targeting specific communities and population, and also provide physical clinic space which should be available in our community. And we have concern about capacity and staffing, and also total throughput and ramp up, including the maximum amount of vaccines that can be completed and the time required to ramp up existing capacity. Next slide, please. So objective vaccinate East Toronto residents as quickly as possible in alignment with provincial direction and vaccine availability, and in collaboration with health system and community partners. Of course, as a community resident, I always advocate for our site. So we almost in every hour meeting, we talk about opening a local vaccine center in Thorncliffe Community Hub. So I hope this would be like priority in the steps taken by Michael Garron Hospital, and we will have that site in our area. And also, yes, next slide. So this is the plan which was set by our committee. So far, you can see what was in the phase 2, and right now we are in the phase 2. And as you see, the priority also opening on-site clinics. Right now in East York, 7, if I'm not mistaken, 7 sites expected to be open, and one of them in Thorncliffe Park. And also we are advocating for organizing mobile vaccination to populations with social and geographic barriers. So this is it. And I would be happy to connect with every resident. And if you have any concerns or something like to be addressed to the table, please connect to me. I would be happy to address those concerns to the table. and bring some needed information for you. Thank you very much, Munira. Thank you.
Thank you, Dr. Shakhlo, and we appreciate your continued and ongoing advocacy for the Thorncliffe Park community. Thank you very much for everything that you do and continue to do. Thank you very much. Iman, I would like to introduce my colleague Iman from Flemington Health Center at the Community Engagement Table to let us know about resources in the community. Go ahead, Iman.
Thanks, Munira. Just going to share my screen real quick. Okay, hi everyone. My name is Iman. I'm with the Flemington Health Center. It's so nice to see everyone here today. So just a quick reminder of the community hotline number that is open for residents of Thorncliffe Park and Flemington Park. So this is the number that you see on the screen, 647-477-1640. And again, this is open for all residents of Thorncliffe Park and Flemington Park. So those who may have been tested positive for COVID-19 and possibly others who are just looking for some information on resource navigation, for example, access to food, or possibly looking for senior support or have any other questions, they can call this number and they will be redirected to identified staff. So this is, again, a community hotline number for residents of Thorncliffe Park and Flemington Park. And if you notice on the flyer, there is a QR code as well. So if you scan this, so if you have access to a smartphone and you scan this QR code, it'll take you to a repository where we have lots more information about community activities. For instance, we have like a drive for kids' healthy snacks. We have a drive for seniors care packages. We have a lot of language specific resources as well, particularly with COVID vaccine confidence. We have links to various news sites where you can get more information that's coming in from the various levels of government. So if you're looking for more information, more detailed information, then all you need to do is just scan this QR code and it'll take you to that webpage. And also a reminder that the pop-up testing sites at Flemington Park and Thorncliffe Park have been extended for the month of March. So you would know that we have 2 testing sites in Thorncliffe Park and then 2 testing sites at Flemington Park. And each one has their own schedules and times, etc. So I can drop a link to this in the chat box as well. So we are encouraging folks to get tested for COVID-19, particularly with schools returning to in-person learning. So if anybody needs help with testing, we are also doing some mobile bus testing. So there is a decommissioned TTC bus that is kind of like posted once a week. So if you need more information on that, you could reach out to Munira or Amira, and they'll be able to provide you more information with regards to where the bus is located if you have trouble accessing any of these physical sites. So we have the one at TNO Youth Center. We have in Thorncliffe Park, we have the one at Jenner Jean Murray Community Center. And then over at Flemington Park, we have the Dennis Timbrell Resource Center. So this is open every Friday to Sunday between 1 to 7 p.m. And then we have the one at Angela James Arena Monday to Wednesday. And again, I'll drop a link in the chat box as well.
Perfect. Thank you, Iman. That's great. So again, if you need any of those resources, please feel free to reach out to any of us. We'll make sure. We're getting close to 5 o'clock. I'm just going to ask our esteemed panel for any closing remarks that you'd like to share with our community before we end our session today. So I'll open it up to either of you.
So I really want to thank you all for having me on the forum today. It was a pleasure and a privilege. Really want to thank Munira and Amira for putting this together, and all those others involved at HATP as well. And I'll be working closely with everyone associated at East Toronto Health Network, for the vaccine advocacy, and to make sure that the rollout and the administration for the community goes as smoothly as possible in the coming weeks to months.
Yeah, and I would echo that. Thank you so much for having me. It's really an honor to be here. And I really, everyone that joined and listened, I think, I really, really appreciate your time, taking the time out to really engage and listen. And my one ask for all of you is that now that we've, given you this knowledge and answered the questions, if you can be advocates and spokespeople amongst everyone that you know. So, if I could have an individual conversation with everybody in the community and share the knowledge that we have, I would. But I do need to sleep a little bit. So I would ask that all of you can take that on. And if you have questions, reach out. We're happy to support that. And, until there's a day when everyone that wants a vaccine has one, please, do all the things like wearing masks and keeping distance. And if you have symptoms, go get tested. And on the little thing on the school front, if you do have kids that are going to schools, then you'll be getting information from the schools about, we're trying to do some regular testing all throughout the East. So not just Thorncliffe and Flemington, but in all the schools to try and prevent COVID transmission in the schools. So if you see that, consider it. And it's just there to hopefully keep the kids in school for the rest of the year. Okay, so I'll stop there, but thank you very much.
Perfect. And Dr. Shakhlo, any final words?
Okay, just thank you very much, and thank you for our panelists to coming today and speaking to our community. I personally try to stay strong and positive, and what I wish to everyone, stay positive and strong. Be safe. Thank you.
That is perhaps the best statement that we could close off today's session with. Stay positive, stay strong. Thank you so much. I thank all of you for joining us today. And you'll hear about the dates for our next session. Currently planned for the last Sunday in March, but we might likely do a session earlier. So stay tuned to all of our social media networks, and we'll be in touch. Thank you very much for joining us today on this very rainy Sunday afternoon, and we'll see you next time.
Thank you, everyone, and have a good Sunday.
Thank you. Take care. Bye-bye.
Bye-bye.
Thank you.
Thank you.